Hi everyone, it's Dr. Carin here. I hope you're doing well today. How are you doing with the smoky air outside right now? It is very, very thick today. I keep looking out the window thinking it's thick fog, so it's feeling a little bit like November, but it is September 14th, and today we are talking about preventing cold sores and shingles. And if you are popping on now, say hi. I'd love to know who's joining me today. So this month, we are doing a little spotlight on immune health. So we're going to be talking all about different aspects of immune function. We know that with the new schedules, new school schedules, and frankly, you've been dealing with new things and adjusting life for the past 6 months. And we know that our health can just kind of get pushed aside when there's so many different new things happening all the time. So we wanted to just pop on and help you, give you some tips on how you can be proactive with your immune system, especially as we head into the colder months of fall and winter. So we're going to be talking about cold sores today and shingles. And I know it's not something that we tend to think about very much until it pops up. But think about the last time you had a cold sore. How did it feel? Was it annoying? Was it embarrassing? Was it painful? Hard to eat? Hard to wash your face even? Did it take a long time to heal? Now, I know that cold sores may not be the biggest concern in your life, but if you've had them before, you know that they can really affect your daily life and that they tend to be a really good indicator that there's something going on with your immune system. And so we really want to take that as a sign for us, listen to what our body's saying, and be as proactive as we can with our immune system and our health. So let's first talk about cold sores and shingles and why we're talking about them together. First of all, both are incredibly common. For example, about 50 to 60% of the population carry the virus, herpes simplex, that's responsible for cold sores. So incredibly common. They're both viruses that are responsible for cold sores and shingles. They're both from the same family of viruses, the herpes family of viruses. So they have some similarities in terms of how they present, some of the risks, and some of the strategies we can use for prevention or even treatment. Now, viruses generally, they stay dormant in the body, but they flare up when our immune system is weakened. Once infected, viruses, they can't be eliminated from the body. So the potential to come back again, to flare up again, it remains there. Now, maybe you're familiar with or maybe have taken in the past antiviral medications. These can be really helpful for shortening the duration of a flare-up, but they don't address that underlying immune imbalance. So cold sores, shingles, they can certainly come back again. So as we head into the fall season, I just wanted to take this moment today, 15, 20 minutes maybe today, to help you to see if there's any way that you can build in immune supportive habits into your daily life, because this is really what's going to help to strengthen your immune system. All right, so let's first talk about just what are the symptoms of a cold sore and shingles and what are these risks. So most of the time, those infected with viruses have absolutely no symptoms. It's only when activated those viruses have this rash, and this is a distinct rash. We call them a herpetic rash. These rashes are these fluid-filled, like little vesicles, little blisters, and they usually have redness or swelling in the background as well, if that rash. Now, cold sores typically, as you probably know, they typically appear on the lips or just outside of the lips, whereas shingles actually emerges along a nerve distribution, and most commonly we're seeing this on the torso somewhere. So it could be around the waist, or it could be around where your ribs are, generally on one side. Now, it could be a rash that's, this big, or it could be a rash that goes all along, kind of like following your rib, all from the front to the back. So it can be really vary in terms of the severity when it comes to shingles. What's happening with shingles is it's actually a reactivation of the dormant chickenpox virus called varicella zoster that actually hangs out in the nerves. So that's why it can follow that nerve distribution, for example, on your torso all the way around. Now, when we get shingles, oftentimes they're described as being itchy, painful. Even before the rash comes out, you can have this temperature sensitivity. Like if you have warm water on that area, it feels like scorching hot water. Very, very sensitive. Occasionally, shingles can occur outside of the torso, like on the face. And especially when it's close to the eyes or the nose, this can carry an extra higher risk of blindness. So always see your doctor immediately if you suspect shingles on your face. Even if you know that it's shingles, even if you've had shingles before, make sure you see your doctor, because it does require a higher intervention, a quick intervention. And it's also important to just make a note here that exposure to blisters does carry the risk of infecting other people as well. Now, most people know that shingles tends to be more common in older adults, but the factor here is actually the immune system health, not really age. Now, shingles can occur at any age because of that, so it's all more about immune system. The first time that I got shingles, I was a teenager, so even my doctor at the time couldn't really believe that I had shingles. So it can happen at any age. It is about your immune system. Now, the best way to reduce viral reactivation or activation for both shingles and cold sores is to support your overall immune health on a regular basis. I'll make a note here too that some people use the terms canker sores and cold sores interchangeably, and they are different things. When we are talking about cold sores today, canker sores tend to be inside the mouth, and they're more like little ulcers or like little craters, whereas cold sores tend to be on the lips outside, and they're more like little blisters, so they actually pop out generally. So we were talking about cold sores today. Okay, so here are 4 things that can cause your immune system to be weak and lead to the virus being reactivated. All right, and after we talk about this, we'll talk about, of course, what are things that you can do to help prevent the shingles and cold sores from coming up. So 4 things that can cause your immune system to be weak that leads to viral reactivation. Missing nutrients is a big one. So your immune system actually needs proteins, vitamins like vitamin A, C, D, B12, minerals like zinc to do its job. So when our diets lack these nutrients, for example, for eating more processed foods, which tend to lack these nutrients, we can have a higher risk of these nutrient deficiencies, and therefore a higher risk of a weak immune system. Number 2, elevated stress. And I think most people who have experienced cold sores and shingles can usually pinpoint, yes, there's been more stress recently. Stress can really suppress your immune system, especially when it's more chronic. That's because our immune system response really requires our body to be in a relaxed state to really allow its full power to be expressed. So immunosuppressive medications can have a similar type of function this way in actually weakening the immune system over time. So lack of sleep is a 3rd one. And now lack of sleep is probably the biggest stress, chronic stress that we can put on our body. The immune system does a ton of important work while we're asleep. So lack of sleep, lack of quality sleep, definitely means the immune system is going to have more difficulty fighting infections, including viruses. All right, and then the last one I'll mention is just other infections There's only so much that your immune system can handle at once, and fighting infections on multiple fronts, viruses, bacteria, yeast, can weaken the response of each, weaken the response to each of those infections. Okay, so what can we do with our habits to support our immune system on a regular basis so that we have less likelihood of cold sores and shingles flaring up? So I want to give you 4 immune supporting habits to build into your daily routine. So on an ongoing basis. So number 1, instead of thinking about saving time, think about optimizing your energy conservation. So what I mean by that is, if you're like me, you try to get as much done in one day as humanly possible in order to save time, right? This is the get more done in less time motto. Now, I know this is what I used to do, so I absolutely know it feels so productive to operate this way. But what I have found that it also leads to quite a bit of this feeling of being hectic and anxious, which does not help the immune system at all. So instead, look for ways that you can build or conserve your energy on a daily basis. So are there things that you can do, for example, with your sleep to make it just 1% better tonight? Maybe that's unplugging the phone when you're going to bed, or removing electronics from your bedroom. In the summary notes for today's video, I'll include some links for other ideas for how to improve your sleep quality as well. Another tip for building energy and protecting energy is, with the cooler weather, oftentimes eating warmer or cooked foods feels better on your gut, but also can actually give you more energy. So that's one that I would definitely try and see if that works for you, especially as the weather cools down. All right, and then next week I will be back talking more about stress and immune system. So hopefully we'll give you some more tips at that time as well. So look out for that. Now, number 2, eat to support immune system function. So we had mentioned the nutrients that can be missing that can actually weaken your immune system. So we know that 70% of your immune system actually resides in your gut. So really good gut health is critical to good immune function. So really looking for habits that can support great digestion can be the game changer here. So that could be maybe food prepping on the weekends for you, especially with the vegetables, so that you get lots of those vitamins and minerals that we were talking about. And that way we can avoid the processed foods that we tend to reach for when we're not prepared, right? When we find ourselves kind of stuck and don't have healthy foods to eat. So instead of eating those processed foods, if we have a little bit prepped, we're more likely to eat the whole foods with lots of colorful vegetables, for example. All right, number 3 is avoid foods that are high in arginine. Now, arginine is a protein unit that's in our diet, and it's seen in a few studies that arginine actually promotes the viruses to replicate, to reproduce. And this is for herpes viruses. And so that's something that we don't want happening, of course, right? So it can be really helpful for some people to avoid too much arginine-rich foods. Now, on the other hand, there is this protein unit called lysine, and that seems to do the opposite. It actually blocks viral reproduction. So a good thing to do is to actually avoid arginine-rich foods. This is like tomatoes, nuts, pumpkin seeds, chocolate, sugar, and actually try to get more lysine-rich foods. So lysine-rich foods are like fish, egg, meat, apples, pears, green beans. So generally less arginine foods, more lysine foods are going to be helpful to keep that herpes virus reproduction down. All right. This is where, again, it's really important to do if you can, some food preparations maybe on the weekend, so that we have some good supportive snacks. I know that sometimes for me, I get stuck and I end up having handfuls of nuts or pumpkin seeds to kind of get me through, and sometimes they become my meal. So I'm talking about not just like a little handful, but maybe multiple handfuls of these nuts, because they're, healthier than maybe having a muffin. But if you're trying to prevent cold sores or shingles, this can be a bit counterproductive. So again, meal preparation, food preparation, having some good backup snacks that are not too high in those arginine foods and in fact high in lysine would be helpful here. All right, the last one, the number 4, supplementing 4 herbs that actually help to defend against herpes. Okay, so we were just mentioning lysine there from a dietary point of view. You can certainly get L-lysine as a supplement. They can be taken preventatively. They can be taken at the earliest sign of some symptoms. This could be for cold sores or shingles, and it has been shown to reduce the occurrence, severity, and the healing time of cold sores, so they can be really helpful. Now, some of the studies have also shown that L-lysine supplementation is ineffective. So if you kind of look at multiple different studies, it seems inconsistent. Some say helpful, some say not helpful. Likely the difference in here is, were those subjects actually following a low arginine diet? Also, how much lysine were they taking as a supplement, and how much lysine was in their diet? So figuring out the right dose for you, this is something that you may want to talk to your practitioner about, because you want to make sure you're getting enough to be effective. Now, another one that many people know about is vitamin D. Of course, in this part of the world, vitamin D deficiency is quite common, and it is a really important part of our immune system. So something to keep in mind, especially as we get in the colder weather, that might be something that your body needs more of right now. And last thing, I want to do a little spotlight on shingles for this last part. For those who suspect that you may be getting shingles, so maybe you're feeling that skin tingling or that temperature sensitivity on your skin, maybe you're actually feeling run down, consider additional vitamin B12. The most concerning complication when it comes to shingles is this, what's called a post-herpetic neuralgia. And this is chronic pain even after the skin rash has healed. And this pain can stick around for months or even years. And it can be mild, but it can also be severe. So this is a really concerning complication when it comes to shingles. One review found that vitamin B12 actually improved the quality of life in people with post-herpetic neuralgia and decreased the use of painkillers. So that's great news. Clinically, I have found that B12 injections can be really helpful when done as early as possible, really helpful in recovering from shingles with minimal complications. So something to keep in mind if you tend to get shingles, you've had shingles before, you're worried about that post-herpetic neuralgia pain, keep that in mind. Maybe have some sublingual vitamin B12 at home ready to go. We know that with increasing age, we have increased risk of vitamin B12 deficiency. We just don't absorb it as well as we did before. So that may be even increasing that risk of post-herpetic neuralgia as well. So that's why I think maybe the B12 injections can be really helpful, because we don't rely on that digestive absorption. So something to keep in mind is shingles and vitamin B12. B12 is known to actually support nerve health. So maybe that's the connection there and why it can be really helpful for preventing or treating that post-herpetic neuralgia. So again, as with any supplements, please talk to your practitioner first before introducing new supplements. Now, I want to reiterate here, if you suspect that you're getting cold sores or shingles for the first time, please see your doctor to confirm the diagnosis. Sometimes they will actually do a test to actually see which virus is involved in there. Even if it's not the first time though, even if you've had shingles before, if you do get sores on your face, especially near your eyes or your nose, please see your doctor immediately. And of course, avoid sharing objects that have been in contact with the areas around the sore, so face cloths and cups and things like that. So the main message today is that cold sores and shingles are a response to weakened immune system. And let's look for ways that we can improve our daily habits, even just by 1%. That could be in sleep, rest, nutrition, or with specific nutrients to see if we can reduce the chance of having those viruses reactivated. Also, if you do get a herpetic rash, I hope this gives you a few more tools to help speed up the healing of your skin and strengthen your whole immune system. So that's it for me today. Thanks so much for joining me. Of course, if you have any questions, please pop them in the comments. If there's any other topics about cold sores or shingles that you want to know about, let me know. I'd love to hear from you. I am off to do some food prep for my upcoming week. So I will be back here in 1 week to chat about stress and immune system. So I look forward to seeing you then. All right, have a great week. Bye.